name is Dr. Bertha AYI, and it's been an exciting journey being part of the WomenLift US Cohort 2022. My project was about leading a global international health organization and mobilizing the members. This year, I was president of the Ghana Physicians and Surgeons Foundation of North America, and my goal was to increase the membership for the intent of providing healthcare back in Africa. Global health. It was an extremely successful venture. We went from a membership of about 54 at the beginning of my term to almost 200 8 months later. What was exciting was how within a month our membership had doubled, and within 3 to 4 months we had tripled the membership. Why? Because people felt the energy of leadership. They felt they could identify with the purpose and intent I was bringing to the organization. And we had chapters opening all around the country, and the organization continues to grow. The growth is to enforce or allow members to have licensure in Ghana and ultimately around Africa to promote healthcare equity. I grew up in Ghana, and for some strange reason, the mosquitoes just loved me. I would have about 13 episodes of malaria every year. And I would ask myself, can someone stop this excruciating pain? Because malaria bouts had to do with bone pain, fever. I was determined that when I grew up, I would do something about it. I therefore became a malaria advocate and somebody who strongly believes I can eradicate malaria. This past year, as I became leader of this organization and as an infectious disease specialist, it was just exciting to see my childhood dream and vision come to pass as I created networks, made friendships with people, and connected with the healthcare leadership in Ghana to implement real change. As I come to the end of my project, I will be transforming into the past president of the organization. My work will continue. What is most exciting is that I plan to lead an organization called One Access to Health, and we're going to solve a lifelong problem in Africa. Access to healthcare, providing equitable, quality access to everyone. In Ghana right now, the WHO goal of 1 physician to 1,300 has not been met. There's 1 provider to 3,000 patients. There are only 10,000 doctors in the country. The World Health Organization estimates that for each population of 2 million people, there should be 1 medical school. When I graduated 25 years ago, there were only 2 medical schools. Today, there are 7, but we need 14 more in Ghana. So One Access to Health will achieve 5 things. Educate the public, because I love creating educational content. Educate the public in many languages, find the vocabulary for many medical terms, and then connect them to providers. We're going to create a social platform, an internet-based platform of healthcare providers that these patients can connect to. If you pick any African country, and let's say you wanted prostate care or women's health, where do you start? There is absolutely no roadmap as to how to find a nephrologist, how to find a neurologist, or any other subspecialty care. What One Access to Health is going to do is to go country by country and connect providers to healthcare workers. And more importantly, my goal is One Access to Health will also license doctors to provide care across Africa. Why should a physician in Ghana not be able to see a patient in Namibia? We're going to use a telemedicine platform to connect all these people. I will leverage the partnerships I have built in global health and over this past year in medical licensing authorities to get this done. We're also going to see how we can increase the number of medical schools in Africa and change the image of Africa as a poor continent with sick people all the time who are always asking for help, to a vision of abundance, of health, where people in the US can come to seek healthcare in Africa. Thank you very much, and it's been a wonderful year. Thank you for watching.